Guys, I want to talk about this month about diabetes. We're going to be literally disease specific on this audio, so that any of your friends, any of your family, anybody that you know that has diabetes or even signs and symptoms of pre-diabetes, that we can start to address right now exactly what to do. You can get this information to them. If you're in that boat yourself, you'll know exactly what to do after listening to this audio multiple times, and you'll really get an understanding of how far off base we are with diabetes and all the treatments and everything that we just see as standard and ordinary. So as we move through this, I want to give credit to John Barron, Dr. John Barron. He's a medical doctor runs the website johnbarron.org or Baseline Nutritionals. We carry some of their products actually in our office. Dr. Barron is a tremendous asset to natural health care in the field. Even though he's a medical doctor, he definitely overcomes the medical mindset with healthcare and gets down to the root of a lot of these issues. So I'm going to be using some of his content as we move through this, and I explain to you beyond just his perspective of things, how we really use the 5 essentials to address all of these issues and make sure that you're on the best healing path possible. So before we actually talk about what to do, I want to paint a picture in your mind, though, because I think until you really see the outcome of poor lifestyle, you really can't get to the motivational stage required to make a life change. The Oreo cookies that are sitting in your cupboard just tend to scream louder than a future that you can't visually see, that you can't really imagine. So I want to paint this picture for you right up front foremost. Number one, you've lived your life eating the standard American diet, so that standard American diet includes lots of desserts and sodas and sweet tea, high glycemic foods like breads and pastas and just cakes, cookies, all the things that we as Americans, especially here in the South, tend to enjoy. So we've eaten those things for 20, 30 years. We don't think anything different from it. We don't see anything happening on a day-to-day basis. And slowly over the course of time, we start noticing more and more issues with weight gain, etc. And then we start seeing high blood pressure and cholesterol, but we never really made the connection. Well, then eventually we start having the bigger issues. First thing, maybe it's neuropathy. You start having the signs of diabetic neuropathy after you've been on medications and insulin trying to control your blood sugar. Now you start having this nerve pain that literally feels like your body is on fire, or you have numbness or just searing pain through your joints as your nerves themselves are actually being destroyed throughout the body. Then you start noticing that you maybe the next step is you start having some blindness. Your eyes start going bad and you can't see at night. But then it gets worse and it keeps getting worse until eventually you lose your sight altogether. Maybe it's kidney failure. You start having urination issues and just problems with over urinating, and then you start feeling sick all the time. You go in and you find out that your kidney function is impaired, and they put you on kidney dialysis. If you've never seen somebody on kidney dialysis, literally imagine having to go into a clinic 2 to 3 times a week, if not more, to be hooked up to a machine for hours on end while they siphon off your blood, run it through a machine to clean it, and then re-inject it back into your body. It's not a fun process. And by the way, you're on that for the rest of your life. Okay, then heart disease. Maybe you end up having a heart attack for the underlying reasons, and maybe you make it out of it, maybe you don't. But if you do make it out of it, you can pretty much bet that you're going to go under a knife where they're going to split open your ribs, they're going to crack open your chest, and they're going to take a vein out of your leg and replace it into your heart to replace the damaged so-called arteries there, just to make your heart work a little bit longer. So, and I had it said to me recently here that the advancements in surgery are so great today that you can literally replace any part in your heart and just keep it going and keep it going. And while that sounds like a fantastic fantasy, that is not the case, because ultimately I see every person with heart disease still dying. So yeah, you might get a little bit longer alone, but does that really mean that you're healthy? So the next thing, usually one of the final stages, is your legs or your arms or fingers or toes. They start turning black as gangrene sets in, because you've lost complete circulation of those limbs, and now they start pulling off toes, pulling off fingers, surgically amputating different parts of your body. If you've known anybody that this has happened to, you know what that does to them, and how literally this is the final stage. Right before the ultimate, you end up actually dying because of this disease. So if that's not graphic enough for you to really realize what's going on here, let me just go through some of the statistics here. According to the World Health Organization, this is just in case you think, well, this isn't very common. I mean, come on, that doesn't really happen to that many people, right? According to the World Health Organization, at least 171 million people worldwide have diabetes, and this figure is likely to more than double by 2030. Around 3.2, by the way, a lot of those are in kids now, because we're seeing diabetes increase in kids faster than ever. Around 3.2 million deaths every year are attributed to complications of diabetes. That is 6 deaths every single minute. Every single minute, 6 people are dying across the world from diabetes. Okay? Many do not realize that they have diabetes, that their diabetes can be managed, and in the case of type 2 diabetes, even reversed. So, we start looking at this and we look at, okay, well, yeah, we're having a lot of people dying, but hey, we've got advances in medicine, right? Well, let's take a look at this one. A major federal study, by the way, of more than 10,000 middle-aged and older people with type 2 diabetes found that lowering blood sugar actually increased their risk of death, researchers reported. So, and this study was published all over the place. Even Time magazine covered this. So, it was discovered that the aggressive use of insulin and pharmaceutical drugs to accomplish this purpose actually increased the risk of death. See, the major problem, let's take metformin, for example. This is one of the common ones. I even know some of our patients are taking metformin, is its effect on the gastrointestinal system. It ranges from a mild loss of appetite to nausea, vomiting, abdominal discomfort, cramps, flagellants, and diarrhea. Many patients find these symptoms impossible to cope with and discontinue the tablets within days. Lactic acidosis is a rare but dangerous side effect of metformin. This is a serious condition where the cells of the body do not get enough oxygen to survive. It is caused by a buildup of lactic acid in the blood. Most of the cases described have been in people whose kidneys were not working well. So there's all these side effects of metformin just taking the drug, but it doesn't really address why the drugs don't work in the first place. I'm going to go into that in a minute. Drugs like glyburide, they work by stimulating the pancreas to release more insulin. So, and it's funny pronouncing this. I guess it's glyburide. Okay, glyburide is so effective that you need to carry glucose pills with you in case you produce so much insulin that your blood sugar drops too low and you fall into a diabetic coma. Of course, it would be kind of hard to take the pills if you're already in a coma. Although this rarely happens, it is indicative of the larger problem with glyburide. So number two points here. It raises insulin levels so high that your body faces all the problems of high insulin levels that we're going to be talking about, and it doesn't repair blood beta cells. It just forces them to work harder, which actually speeds up the breakdown in the process in which they become dysfunctional. So extra insulin in the form of pills or injections cover you when the beta cells in your pancreas have burned out and can no longer produce sufficient insulin by themselves. However, until your body's insulin resistance is so high that no amount of insulin is enough, at that point your body goes into rapid decay. So this is I'm going to read to you Dr. John Barron's bottom line to all this. He says, forcing blood sugar levels down does nothing to relieve the underlying diabetic condition. It merely suppresses just one of its manifestations. If you want to prevent and reverse diabetes, you have to reduce sugar intake, reduce insulin resistance, improve beta cell function in the pancreas. I want to put a side note on there of function, and protect and repair insulin sugar damage to mission critical organs in the body. And you have to do all of these things all at once. Since diabetes is not a single straight line progression disease, you need to stop every single echo simultaneously so that no aspect of the disease can reverberate and start the whole process moving downhill again. You need to stop it all, or it will all start again, end quote. So what he's referring to here is the echo effect that you see in diabetes. See, diabetes is not a disease where, it's a linear progression like, say, arthritis. With arthritis, you start the degenerative process. It doesn't go backward. It only goes forward. You can slow it down or you can speed it up, but it still moves in a linear forward direction. The problem with diabetes is it echoes. It's imagine a situation where you take a rock and you throw it into a pond. Okay, as the rock drops into the water, it creates a ripple effect, sending that ripple out in multiple directions. So obviously, it's not a matter of like a ball rolling down a hill where you can just put your hand in the way and stop the forward progression. The issue there would be, you throw that rock in the water and you put your hand at one place in the water. Yes, you stop the ripple in that direction, but you don't stop the ripples and go in the other directions. So you literally need to contain diabetes from all directions if you want to really pull it back in order. So I don't want to intimidate you by that. I want to make sure that you have a thorough understanding of this so that you can really contain it in all directions and see how this is possible. So we're going to start off by going through the two major premises behind diabetes. The first one is insulin, okay? A little bit about insulin first place. Insulin is a master hormone of metabolism, okay? The normal human range is 70 to 110 milligrams per deciliter. Insulin is produced by the beta cells in the pancreas. And a note on that, if your blood sugar rises above just 100 for even 2 hours consistently, beta cell failure is already detectable in the literature, in the research. When they look at this, you can already see beta cells failing after just 2 hours. So what that translates to, a blood sugar of just 110 can lose upwards of 40% of beta cell capacity in just 2 years. So if your blood sugar is consistently high for just 2 years, you may have already lost 40% of your pancreatic function. So what happens then? Of course, now you have even more reduced beta cell capacity. So the cells that are remaining, that remaining 60%, now what do they have to do? They have to work harder. So that means they start to burn out faster. As you burn those ones out, now the next line, the remaining cells have to work harder. So, it's kind of like in a military campaign, you might have 1,000 people on one side of the army, but if you knock off 600 of them with the cannons up front or with a bomb, you've got 400 left who now have to work that much harder to win the war. The more you kill off, the harder the remaining have to work in order to continue the fight. So, when blood sugar increases, insulin then packs the sugar into the cells, and as glycogen, so it's packing the sugar into the cells, but it also packs away sugar into the liver as glycogen. Okay, I want to notate here that this is an intelligent response. So the blood sugar increases. Insulin is released within the body to start storing away sugar so that the blood sugar level is contained. That is an intelligent response. Okay? When blood sugar decreases, glucagon is used to release the glycogen from the liver. Again, this is an intelligent response because the glycogen is then released in order to bring the blood sugar back up to normal levels again. Okay, but this is intelligent processing of the body, keeping things in check all the time. And it's amazing what kind of a narrow level that this maintains in itself all the time. Okay, the next one, when noradrenaline is produced by the adrenal glands, which are known as the stress glands, it strongly inhibits insulin production to keep sugar available for the flight or fight response. Okay, so what that means, if you're under a state of stress, then your adrenal glands produce noradrenaline to deal with that stress, to make you ready for a instant ability of action. And of course, with every action requires sugar. So that sugar is made available so that your muscles have something to burn in case you need to do something quickly, to run away from a tiger, or to, move out of the way of a rolling boulder, or, something of that nature. But when you have your stress levels always at alert, that strong inhibition actually keeps your blood sugar high. Again, though, you've got to see, I want to point out there that is an intelligent response of keeping sugar available to the muscles. All right. So all those points are very, very important, that you see that there is an intelligent response going along all throughout this process. All right. So looking at the cells, your cells have insulin receptors, which basically act like gatekeepers. Okay, the insulin receptors on the cell, they open or close to insulin. So insulin comes along with sugar, and it opens up those doors so that sugar can be crammed into those cells. But I want to make a simple analogy for you here. Think about a crowded nightclub. Okay, you've got a nightclub that opens up, and they have a huge line packed out the door. All right, so the doorkeeper, you can call him Mr. Mr. Insulin. He's standing at the door and he's collecting money. He's collecting the tickets, and he's packing the sugar people into the club. Okay, so he's packing them into the club. He keeps taking money, packing them in, taking money, packing them in, taking money, packing them in. Okay, and there's this never-ending line at the door that just keeps on piling up more and more and more. So, they have a problem. The club opened, and you have all these people out front that need to go somewhere. So, he calls in some reinforcement. So he gets a couple of the bouncers to come over and work as insulin as receptors too. So, that triples or quadruples the availability to be able to pack in more of those people. So they just keep on packing them in and packing them in and packing them in. Well, a problem happens. Sometime after a short while, the building literally reaches capacity, and you can't pack in any more people. So there's more people left out there on the sidewalk, and they start getting upset, so they start, dumping trash on the ground, or they might start, throwing beer bottles. Some of them are getting in fights. Basically, they're making a mess of the street. And so the receptors at the door are thinking, we got to get these guys inside. They're getting upset out here. They're doing some damage. They're creating a ruckus. So they keep on trying to pack as many as they can in there. And because they're bouncers, of course, they're strong, so they can literally force some more people into the door. Well, eventually there's so many people crammed in there that even the bouncers can't cram any more people in there. They're literally not strong enough to push any more people in. So they're tired now. They're burnt out. They just say, you know what? I can't do this anymore, and they quit. So they walk away. They just quit altogether. So now you have this situation where the club is cram-packed full of people, but then there's still all these people out on the street, and they keep on lining up. They just keep on coming and keep on coming and keep on coming. So you see the problem with this analogy, is you've got two problems going on here. You've got the crowded building, but you've also got the street that just keeps on packing out. So amazingly, in the body, though, it takes years, if not decades, for us to wear out these insulin receptors. So, but due to that, after that years and decades of abuse, the insulin resistance then causes an increase in triglycerides due to fat cell resistance. So the fat cells, they start breaking down, and triglycerides start increasing throughout the body. So now you get high markers for heart disease. The next thing is you end up with reduced storage ability in the liver and muscles, because of course the insulin receptors in the liver and the muscles are just the same as anywhere else. So that's where primarily that sugar is stored. So, that storage level is reduced. Blood sugar again remains high. So these are some signs that your insulin is high. Okay, just a few of the signs. Number one, heart disease. If you have any kind of heart disease implications whatsoever, hardening of the arteries. You see sometimes when we're looking at X-rays, we'll actually see plaquing of, for instance, the main arteries coming off the heart, or the abdominal aorta. We'll actually be able to visualize plaquing of these arteries on the X-rays. So you might, but beyond just the plaquing, you might just see hardening of the arteries as you're beginning to see a buildup there. Increased cholesterol levels. Even if you don't see plaquing of the arteries yet, if you have increased cholesterol, this is a sign that there's this underlying issue going on. You got to see that all these problems go hand in hand. Heart disease, cholesterol, diabetes, they're really all manifestations of the same type of issues. Increased triglycerides. We already talked about that one. High blood pressure, same type of issue. So if you're taking blood pressure medications, you're probably on this same exact path. I mean, not probably, unless you just got done running or doing some kind of exercise for your blood pressure to be high, then somewhat, in some level, this is going on. Okay, vitamin and mineral deficiencies. You see this go hand in hand as the body is just depleted of what it needs to keep repairing itself. Kidney disease. And then the last ones, which are probably the most prevalent and easily read, is weight gain, obesity, and weight loss resistance, which we see all over the place. So these are just some of the signs that you see that your insulin might be high. So you can actually get tested to see if your insulin is high by going to LabCorp, or, some of these other places. Go through your doctor. If you even have a primary care physician, a primary medical doctor, they can order these tests for you. So, that's the number one problem, is just understanding how insulin works. Okay. The next part of the equation is high sugar damage. Okay. The actual, not just the insulin, but the sugar damage as is backed up, like we said, the crowd in the streets. This is what happens with the sugar damage. So the kidneys are then used to filter out excess sugar, hence increased thirst and urination. All right, I want to point out again here that these are intelligent responses. So as your body sees this excess sugar in place, your brain tells your kidneys to start increasing its processing, to clear out, literally dumping sugar into the kidneys and getting it dumped out of the body. So literally your urine begins to get concentrated with sugar. So this is just a little history lesson. Way back in the day, imagine this: doctors used to actually taste people's urine to see if they were diabetic. Yeah, ask your doctor nowadays if he's willing to taste your urine in order to see if you have diabetes. Highly unlikely, but literally that's all they could do back in the day. So that excess sugar makes the urine taste sweet. All right. So again, though, I can't reiterate this enough. It's a intelligent response that your brain now triggers the response of thirst, so that you now become thirsty, hence increasing your water intake, hence increasing the fluid that can be processed through the kidneys and urinated out to remove that sugar. It's literally a diluting process in the body. All right, the next thing that happens is capillary beds and small vessels and arteries throughout the body narrow to decrease the amount of damaging sugar that's actually reaching your organs. So in order to keep your body healthy, of course, your organs have to remain healthy. So your brain sees that this sugar is actually damaging your organs, and your organs want to shut off that sugar from being able to reach them. So what does the brain do? It limits the amount of blood that can reach your organs as a intelligent response so that you don't continue doing damage. The problem is when that problem just continues over a course of time, you have this dichotomy of, do you reduce the sugar from reaching the organs, or do you reduce the amount of oxygen and nutrients that are reaching the organs? Because they go hand in hand. So if you narrow blood sugar, you're also doing the other side. So it's inevitable, no matter which way you go, you're still going to have damage to those organs. Nonetheless, intelligent response. The first place that you see these things happen is typically with wound healing. You see that cuts and scrapes and wounds just don't heal like they used to, because your body, one of the main issues here is that the increased sugar literally caramelizes proteins in your body, primarily collagen, which is used to repair wounds. Collagen is the primary protein of soft tissue that you see in scars. So, of course, if you go to if you look at a lot of the products on the market, or you go to a plastic surgeon or something, or a skin technician, they try to do collagen repair formulations, to try and remove the sightliness of scars, through repairing, and kind of cleaning up this collagen. Okay, so the next things that you'll notice is the eyes. They typically go bad because the eyes are a high concentration of some of the finest capillary beds in the entire body. They're loaded with these tiny microscopic capillary beds. So they're some of the first ones that get affected. And as, of course, they get affected, now you start losing the ability to see. And then the last one is the feet. Why? Because the feet, not only do they have a lot of these small beds, but they're at the distant most parts of the body. So not only are they a far distance away from the heart, but they also are at the bottom of the gravitational chain. So as you have gravity impacting the small capillary beds, you just can't get proper blood flow through that area and circulation. So you start to see the feet turn blue, and then black, and then gangrene, and then of course you start seeing the tissues dying as they lose oxygen carrying capacity, and you end up needing to get amputee removal of those parts. The last thing, is of course diabetic neuropathy. That ensues due to the increasing blood sugar now affecting the nerves. So all of these things happen because of high sugar damage outside of the cells, just free floating throughout the body. Now in what we need to talk about to do in terms of what we need to do to accomplish in getting you back in order, these are some of the issues that we need to tackle. Number one is you need to reduce sugar intake, or at bare minimum, inhibit absorption. Now, I know what you guys are going to be looking for here as we're moving through this. You're going to be looking at this, the second that I start throwing out herbs and vitamins and stuff like that, you get out your little scratch pad and you start scribbling it all down, because here's what that really means to you. It's, what can I take from the outside in to allow my body to function a little bit better so that I can keep doing what I want to do and what feels good and not have to change my lifestyle at all. That's what that really means. So before you go and jump out and start ripping out the scratch pad and writing these things down, or, hitting the replay button again, so that you can catch the whole list here and go to the health food store and start buying these stuff up, keep in mind that these are only secondary to you've already made the other lifestyle changes that we're going to talk about in the end here. But on that note, there are some things that you can do to minimize and inhibit absorption of these high glycemic foods in your diet. A couple of these are nopal cactus, and one that's been used for probably hundreds of years. This one has a lot of credit in India. They use this with diabetics on a regular basis. It's called Gymnema sylvestre. Okay, Gymnema it's an herb. Okay, so those are two things that do inhibit the absorption of sugar from these foods. Number 2, you need to lower blood sugar levels, or at bare minimum, assist in the leveling. Okay, a couple of the herbs and vitamins that you can use to help out with that process. Number 1 is fenugreek, which is also used with pregnant moms, postpartum moms, to increase milk supply. So men, you might start lactating. I'm just kidding. You don't have to worry about that. But with fenugreek, it is an interesting note. They use fenugreek to make artificial maple flavoring, or the scent of maple. So it's really interesting. My wife had actually used fenugreek after our children to just keep her milk supply up, and I used to actually call her McGriddle because she smelled like a McDonald's McGriddle sandwich as she was taking these, because of course they use it to make them smell that way. So she didn't like that name too much. But anyways, the next things that you can use is Mamordica charantia. You can use corosilic acid or mulberry. So all these things you can do some research online before you just start, taking this stuff. Number 3, remove sugar from the cells. Okay, go back to the crowded club analogy. Even if you reduce the influx of new people into the club, does it really help the situation? Of course not, because the club is still cram-packed. People are still inside spilling their drinks on each other and sweating all over the place and, climbing on top of other people trying to get to the restrooms. You still have the problem of there's nowhere for the sugar to go, even in reduced amounts, because the cells are cram-packed. Okay, number 4, reverse insulin resistance, or at bare minimum, assist in that repair of that resistance. Some of the things that work well for that: konjac mannan, sinulin PF is a specialized extract, chromium GTF, and omega-3 fatty acids like the Maximize Living Perfect Ratio Omega. You guys might know right now that as Pro Omega RX. We are within a couple weeks going to be replacing that with the new name and the new packaging. Same product for the most part, but it's now called Perfect Ratio Omega. Hence relaying the issue that it is a perfect 4-to-1 ratio compared to all the other hundreds, probably thousands of omega products that you see on the shelves out there, which are dramatically out of balance, omega-3 to omega-6. Okay, the last one, number 5, you need to repair beta cells, or at bare minimum, help them to function better. So the things that help with that, again, Gymnema sylvestre and alpha lipoic acid also help with this. So I want to put in the bottom line here, though, is that you can't outsmart the problem. Okay, no matter how you do this, you're not going to outsmart the problem. Whether you're doing it with nutrition and herbs, or you try to do it with drugs or surgery, even worse, you're not going to outsmart the problem, because the problem is lifestyle. And literally, we're lifestyling ourselves to death. So what is the right way, start to finish, of dealing with this issue? Well, of course, you can point straight back to, just like everything else, the 5 essentials of Maximized Living. So I'm going to walk you through these 5 essentials of Maximized Living, and each one how they affect diabetes particularly. So essential number 1 is Max Mind. The key here is that you need to reduce stress to reduce insulin suppression. Okay, we talked about the fact that stress increases your norepinephrine or noradrenaline levels, and by doing that, you inhibit insulin production within the body, which keeps sugar in the bloodstream. So in order to relieve that process, you need to reduce your stress levels on a daily basis. Okay, so that's Max Mind. Essential number 2 is the spine and nerve system, optimum function of the spine and nerve system. So you clear the nerve system interference through corrective chiropractic care to restore function and to restore healing. Okay, how can your body recover from a serious condition like diabetes, where your pancreas is not functioning correctly, if you have nerve system interference leading to the pancreas? Or how can you repair the liver and the muscles if you have nerve system interference of those nerves going to the liver and the muscles? You see, it makes absolutely no sense whatsoever to try and repair your body if you're not keeping the nerve system clear, because that is what controls function and healing within the body. It's absolutely essential. Okay, essential number 3 is quality nutrients. So you need to first and foremost, this is probably one of the most important factors in diabetics, is you need to remove all incoming sugar to give the body a chance to recover. You do this through the Maximize Living Advanced Diet. Okay, so go back to the club analogy. Even if you have a small line of people that keep on coming into the club, keep on coming in, even if you're slowly leaking some people out the bathroom windows, as long as you have a new leak of people coming in, then you're never really having an opportunity to get a handle on the problem. So you've got to reduce and literally remove all incoming sugar from the diet. So the Maximize Living Advanced Diet, as available in the Advanced Nutrition Plans book, and in various places throughout the website, the patient manual, and some of the other audios. I'm not going to repeat it all here. That's the means of doing that. Okay, and then also you support the body and organs in their repair process through quality supplements and these things, particularly rich in antioxidants, which are the repair factors in the diet. So you need to make sure that you're taking the core nutrients such as vitamin D3, perfect protein, the whey protein, the grass-fed whey protein. You're taking things like the perfect ratio omega. You're using things like the daily detox for its antioxidant load, to make sure that your body has all of these essential nutrients to repair, rebuild, and support the idea of the age-old motto of "you are what you eat." You've got to have the good stuff there. Okay. Essential number 4: you have to clear the crowded club. The way that you do that, the way that you clear the crowded club out, is you have to literally burn off the sugar congestion within those cells. Okay, so if you have all this sugar in these cells, what's the only way that you're going to get them back out of the cells? Well, you have to play the process in complete reverse. So what that means is you need to now create an energy demand within the body. Well, are you going to do that by sitting on the couch being lazy? Or in reality, are you even going to do that effectively by going for an hour-long easy stroll through the neighborhood? Of course not. You're never really going to deal with the issue effectively unless you create a massive energy demand within the body. And the best way to do that is through surge training, as taught by Maximize Living doctors. So the surge training is the most effective way to do that. If you're not sure on how to do the surge training, go back and listen to the previous audio on exercise and fitness. That will clear that up for you. Okay, so that's going to clear out the cells, make sure that they're starting to shed off the excess sugar so that there's now some place to go for any sugar that does happen to leak back in through the diet. And then essential number 5 is detoxify the body and organs using high quality programs such as the daily detox, the perfect ratio omega, or even we carry a product by Baseline Nutritionals called blood support. All of these different things, they're going to start removing the clutter in the body that's actually keeping the body from repairing itself. Of course, think about cancer once again. That cancer is literally breakdown of the cells within the body that they're breaking down faster than your body is able to repair them. So anytime that you detoxify your body, you're removing chemical subluxation from your body so that you can heal and repair that much faster. So there it is. That is literally 5 simple essentials on what needs to be done to start to reverse the diabetic process from start to finish. You're literally covering every side of the echo factor there. And then you can start to add on some of those previous talked about herbs and vitamins in order to just support your body and help this process along that much faster. So I want to point out in final to this is that if you just pick and choose what area you feel like doing, like let's say, well, you're listening to this and hey, you know what? I heard Gymnema sylvestre mentioned a couple times and, happen to be on the internet and read some more about Gymnema, and there's this great product that is touted to cure diabetes. So I'm just going to do that. Well, you see, that's not really going to do anything, because that's like throwing that stone into the pond, like we talked about earlier. You throw this big old stone into the pond, it sends out ripples in all directions, and you literally think you're going to stop it by sticking one hand into the water. You stick one hand in the water, yeah, you might block one part of the ripple, but that ripple is going to continue in all directions, and in fact, it's going to circle around your hand and keep on going. So you've got to literally contain the ripple from all sides. The only way you're going to do that is by covering it through the 5 essentials from start to finish. So the last thing I want to leave you with here as we move out of this audio and just kind of clear this all up, I wanted to keep this clear and concise. Even though we could go on hours on this topic, I wanted to keep it short enough that you feel like you could go back and listen to this multiple times, because there's no way that you're going to really sink all this in just listening to it one time, especially if you've lifestyled yourself into diabetes already. So the next opportunity that I want to make sure that you come to is the Maximized Living Makeover. This is the international makeover. This is going to be going on. The target within Maximized Living, we expect to have over 10,000 people across the United States, Canada, and beyond, Puerto Rico, England, Australia, 10,000 people going through this makeover in one single day. Okay. We locally here in Mobile are having our makeover at Mars Hill Cafe on, as I said, Saturday, October 9th from 11 o'clock a.m. until 3 o'clock p.m. All right. One really cool factor with this, beyond the fact that we're going into all of the 5 essentials, we're going to be talking about giving you a game plan, getting your mind in the right order. We're going to be talking about the nerve system. We're going to be covering advanced nutrition, the healing diet, the advanced diet, the core diet. We're going to be covering advanced fitness, specifically surge training. We're going to be talking extensively about detoxification. We're going to be covering a lot of stuff in my 3 hours. But we also, that final hour, that fourth hour, which is going to be there in the middle somewhere, we have a special guest speaker. His name is Tarek Faridi. He's known in chiropractic circles as the human encyclopedia. This guy is absolutely incredible to listen to. We've had calls in the past. I've been on international calls, conference calls that I've heard this guy speak, and he is so passionate for wellness and for getting sick people well, it makes chiropractors go to shame. I mean, this guy isn't even a chiropractor. He's a medical and chiropractic researcher and historian and businessman that just knows the world of chiropractic history and what it takes to get people healthy. So he's literally going to be going through the history of chiropractic, that how medicine has tried to squash out chiropractic, the facts behind it, and showing you in the history how chiropractic has survived based on a correct principle, despite all of this basically enslavement on the part of the medical system. He's going to show you that. He's also going to show you, literally going through vertebra by vertebra in the spine, what diseases are caused by subluxation and nerve interference of those vertebral levels, and how removal of subluxation through corrective chiropractic care is absolutely critical to restoring people back to health in those situations. And I'm telling you, the 24 different vertebral levels and the diseases that they cover, these diseases, I mean, it's going to blow your mind, because these are the most common diseases that you see in society today. Yeah, I mean, it's how in the world people have not been exposed to this, and how this secret has been hidden away is just, I mean, it's just blasphemous. So you guys are not going to want to miss this. We're bringing him in all the way from Fresno, California to be here. So not only do you want to be there, but I'm going to ask for your support and bring in your friends, your family, and anybody you possibly can so that we can show this guy a warm response and we can make it well worth his while to come all the way down here across the country to be able to educate you and your family. So guys, get signed up right away. We have registration forms at the office. If you're listening to this audio, pick up the phone as soon as we're done and call the office at 251-607-0040 to get more information. We can fax you or email you the form if you don't have the ability to come and pick it up at the office. But call the office immediately if you have to leave a message, and we'll call you back as soon as possible. So just make sure that you get to that event. In summary on everything, the purpose in doing this audio, I want to see you guys not fall into the same trap that we see literally millions of people falling into all over the globe. It doesn't have to happen. It's well known and well established in the research that type 2 diabetes is completely preventable and completely reversible in almost every single situation. So what that means is there is literally no excuse for you to fall into the same trap, because now you know if you've listened to this audio. So pass this on to your friends and family. If you have a CD in your hand, pull it out of your CD player as soon as this is done and hand it off to somebody that you know is walking this path. If you guys know multiple people, take it home, copy it in your CD burner, and hand it out to everybody that you know. You are perfectly able to do that, and you do not need my permission. You have my permission now to be able to do that. Or you can even just send them to our website at drbucknell.info. That's DRBUCKNELL.info, and you can access the entire treasury of audios and even our patient manuals. So thank you guys so much for your commitment to the mission. Thank you for getting people involved. Thank you for helping people that are around you. And keep in mind that knowing makes absolutely no difference whatsoever if no action is followed because of it. So get on it. Get in action, do something about it today, and don't just think that the knowing from listening to this did you any bit of good whatsoever. We love you guys. I look the best for you in the future, and we will see you at the makeover Saturday, October 9th.